You are watching JapaNEWS.
One of the issues US voters say they care the most about right now is healthcare. America is almost alone in the developed world in not providing its citizens with universal medical care. Japan, on the other hand, has universal health, though it differs from many other countries in that it is paid for mainly through premiums to the central government, rather than derived from tax revenues. In essence, it is a separate tax based on one's income. Let's look at the 7 major differences. Number 1. Coverage. 100% of Japanese have health insurance. It's required by law to be covered by one of the 2 kinds, employment-based health insurance and national health insurance, both administered by the government. However, the system now faces serious fiscal pressure due to the sluggish economy, the rapid aging, and low birth rate of its population.
Tests for new coronavirus will be covered under the national health insurance system.
The government will allow people to undergo testing at hospitals or by contracted private testing companies without being referred by health centers. The government will also boost efforts to develop simple test kits, as it currently takes a few hours to detect the virus, officials said. In America, you are not obligated to join public or private health insurance. The public health insurance system is only available to people over the age of 65, persons with disabilities, low-income earners, U.S. military employees and their families. In 2018, 8.5% of people, or 27.5 million, did not have health insurance. By contrast, in 2013, before the Affordable Care Act took full effect, 13.3% were uninsured. Number 2. Cost spent in healthcare. According to 2016 data by OECD, Japan spends 10.9% of its GDP on healthcare, which translates to $4,519 per person. America spends 17.2% of its GDP, being $9,892 per person per year, by far the highest proportion and cost in the world. Number 3. Selection of doctors and hospitals. Japanese can choose their own doctors and hospitals to their likings, while Americans must choose within the network affiliated with the insurance types and companies they have, and you cannot see a specialist unless you get a referral from your primary doctor. According to OECD data, Japanese residents averaged 13 doctors' visits per person in 2011, which was more than 3 times higher than Americans in that year. The major reason could be due to the fact that many Americans cannot afford to go see the doctor or seek medical treatment. Number 4. Premiums. In Japan, the payment ranges from 5.8 to 9.5% of your monthly gross income for the employment-based insurance, while freelancers must pay the average of 8 to 12% of their income. The average premiums for a Japanese family is around $280 per month. In America, it all depends on the insurance company and the plan you join. In 2016, premiums for individual coverage averaged $321 per month, and family plans averaged $833 per month. Number 5. Fees and copayments. In Japan, your portion of medical expenses is fixed at 30%. Keep in mind that the initial bill is always a lot less compared to America, because the government sets all fees for medical services and drugs. All providers, no matter whether private or public, share the same prices for their medicines, devices, and services under the nationwide fee schedule. In America, it all depends on the plans and coverage you choose to have. Medical bills are the highest amongst the developed countries, higher drug prices, higher salaries for doctors and nurses, higher hospital administration costs, and higher prices for many medical services. Number 6. Profits over patients. Japanese hospitals cannot operate for profit by law, but facilities that provide care for elderly and disabled people, such as nursing home care, can operate for profit, and most do. American private insurance companies are for-profit and subject to state and federal regulation. You cannot buy cheaper insurance from another state. The profits of the hospitals are entangled with major pharmaceutical companies and insurance companies, causing the chaotic structure and extremely expensive cost for patients. Number 7. convenience. Japanese can just walk in. Any doctor or hospital, doctors prescribe medicine on the spot for patients to receive. In America, you must pick up your prescription at the nearest pharmacy of your choice afterwards. As far as seeking the treatment, your doctor must be within a certain amount of miles of your home. If your doctor moves and exceeds the mileage, you cannot visit any longer, even within the same state. Ambulance rides and transportation to hospitals also must be within a certain distance, unless the ailment requires a special hospital or you've been in an accident far from home.
Thank you for remembering to subscribe now. Woohoo!